Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio. Welcome back to our program today. We have two really special folks with us. Well, one sort of special. Hawkeye's back. What do you know? You can't get rid of the guy. You try all the time, and then his family starts sending us pictures of stuff. Wait till the end of the program. We have more to show you around that. But also with us today is my good friend, Dr. Girod, who is the Chancellor over at the University of Kansas. Welcome back to our program today, Chancellor.
Thanks for having me back.
It is a delight to have you. So we're going to first turn to Hawk. Hawk?
It's not good.
Not good.
It is not good. We talked about how happy we were when we reached 9 or 10 patients in the hospital. Yesterday we talked about, in the last few days, we've been talking about how we were not happy about the increasing numbers. And our numbers were at 30 or 31 yesterday. Today they're at 34 in the hospital. And the real concerning part about that, just besides the number, is that we had discharges. So we got even lower yesterday than we were, but unfortunately we've had like 7 new admissions to the hospital for COVID-19. 12 of those are in the ICU, but even our vents have gone up. So we have 4 people on the vent compared to 2 yesterday. So really overall we're seeing the numbers in the health system, in the hospital, increasing, and that's just not a good thing.
Yeah, it's real.
It is.
It's not influenza.
It is. And we're running short of critical medicines such as remdesivir. Hopefully we don't run short of the critical medicines that when you're on the vent to keep you comfortable. The anxiolytics, the paralytics, things to just make you comfortable when you're on the ventilator.
Yeah, things are going to get tough. It's going to be a little bumpy, I think.
Yeah.
And I think it's all about what we say every day. You can't gather in big groups.
Mm-hmm.
Try to stay away from bars.
Yeah.
And then, trust me, I love going to a great bar and grill. That's like one of our happy places, right? You and I have done a few of those over the years. And but the problem is that we have to socially distance. We have to wear masks. You got to wash your hands or use the alcohol sanitizer. I mean, it just really does make a difference. It's interesting. We were had a discussion yesterday, Dr. Girod, about things in Lawrence. And one of the things I heard from Tom Marcellano, who is the medical director for Douglas County. And you know him. You're like med school roommates. It's like, this is such a small world. I think everybody knows Hawkeye. Is that after Douglas County, as I understand, closed the bars again. And all of a sudden, the number of new cases are starting to flatten out.
Well, and we saw a spike, and the vast majority of those new cases could be tied back to two bars.
Yes.
And so Dr. Marcelino made the decision to close them back down again while we kind of got our
feedback under us.
Yeah.
So opening up the campus again and welcoming students back is a big deal. We've been working together, which is always a great pleasure, to try and figure out how to do that safely. And I think you guys, there's a great plan out there.
There is, and I really appreciate the help of the health system of Lawrence Memorial Health, who's been a great partner as well, working with our Watkins Clinic and our whole operations team to think about how you do something that really doesn't happen anywhere else in America.
Right.
Which is,
I call it mass migration.
Mass migration, which is an influx of people into a community that increases the population of that community by 20%. In a few weeks. And so
it's crazy.
Thinking through the logistics of that and working with the county as well to think about that has really been an interesting exercise and how to do that safely. And I really do think a good plan is coming together around that. And of course, every university in America is trying to figure this out right now, but I think we're ahead of
I think we are too.
Quite honest with you.
And I think there's some unique aspects of that, and we should probably touch base about some of that. Do you want to kind of?
Sure. It goes everywhere from how do you start out. So that's sort of our testing program that we're developing. It's in development, but working with you all to identify a great partner in CRL Labs down in Lenexa, who has developed a saliva test that we think we can do on a mass scale. Mm-hmm. And our intent is to test everybody, faculty, staff, and students as they come back, and we're going to strongly encourage them to do that and provide that for free. And so at least we can zero set at the start of the semester that if we know folks that are testing positive, we've leased a private dorm, Naismith Hall, and that will be our quarantine site. So if people come in and they test positive, we'll have a place that they can stay while they go through their required clearance and get medically cleared to enter back into the community. And then, of course, we'll have a monitoring program, an ongoing testing program as well through walk-ins to go throughout the semester. But working really hard to try and start out as safely as we can. We've worked with our faculty to identify different levels of personal protection of what they're comfortable with in the classroom, and then we've gone through all 350 classrooms to figure out how to socially distance, how many, what's the density that you can do in a classroom and stay safe, stay socially distanced. Everybody's going to be wearing a mask on campus for the semester, and re-engineering the buildings to be one way. So stairways are all one way, hallways are all one way. Just really trying to think through every element of campus life in a way that allows to have as much face-to-face interaction as safe. But they'll be in a hybrid version, so some elements of almost every course will probably be online, and some elements will be face-to-face. Some things like design studios and performances and other things we're getting pretty creative around. But we're excited. I mean, I think we have a solid plan. The team's worked really hard on it, and we really appreciate the help of the health system as we've gone through this design phase.
Yeah, I think and that mass testing thing has been no small feat, and involved a lot of people to try and pull that off. And I think it's going to work. It's going to be salival based. We'll be testing everybody upon entry, as you mentioned. And the goal with that isn't necessarily to stop COVID, because we're not going to stop it, but to catch it before it spreads like a wildfire through the campus and through the community. Because I think the campus is within a community. When people go to the store, or they go to the restaurant, or they go do whatever they're going to do in Lawrence, and there's a lot of students who live off campus, then that could represent a threat to a community. So we have to do things that can keep the community safe. I think mass testing is a good start, especially because you get to then quarantine those folks in Naismith Hall. I mean, I don't think we could have done better than what we're doing.
I would agree with that, and really appreciate the help at the county health department and then with KDHE and thinking about what is truly a unique environment. There really is not another place in the state that is going to experience anything like this other than our sister institutions at Manhattan, Wichita, and out of Fort Hays and down at Pittsburgh and Emporia. So these are fairly unique events.
They are unique
and pose a real logistical challenge, but the team's really been up to the task. And we still got a few more bugs to iron out in terms of the collection side of that, of how we're going to process through that. But I feel good about where we are right now.
Yeah, I feel good. I'll feel even better when we get people hired to help us do some of this stuff we're talking about, because this is great. The other fascinating thing is I think we're trying to do modeling for the campus that's also a little bit unique in both modeling for what does a spread event look like on the Lawrence campus, what does it do to the community, and that fortunately we have some expertise here in Lawrence and on the campus to help us do that. That's pretty unique as well.
It is, and already we've been working together with the county to develop their model, but their model is going to change a whole lot in August when we change the demographic of the city pretty significantly. So Dean Ojo and School of Medicine is going to help us build a model out for our campus, which looks very different than any other community. It is a community of over 30,000 people, but the age demographic is not reflected by most communities.
And it's a little more dense than a lot of places.
It
and
is.
You think about that because it feels a little like New York City. We don't want it to do that, but if people are denser on a college campus, and it is a mass migration. 20,000 people come into a community of 80,000, and all of a sudden, what just happened, right? What just happened, and that's going on all around the United States. And you think, what does that mean? I think this will be one of the great challenges of our times.
Well, and I feel really blessed to have the advantage of having a partnership of a health system of this magnitude that's been so involved in this pandemic since day one and has learned so much and taught us all so much about testing, about symptoms, about treatment, about management. I mean, we've learned so much over the last 4 or 5 months that's going to be really helpful for us as we work our way through the semester.
Well, I'm just going to say, and anybody who doesn't know, we're pretty darn good friends. So I think, just to say it, I think Lawrence is blessed to have you be a chancellor. I mean, have him be a brilliant guy, a physician, just a really good person, and someone who knows how to care about people. That's a pretty great combination. I mean, a lot of those things a lot of chancellors may fit some of those bills, but they're not all docs like you are.
Right. Well, turns out at this particular moment in time,
that's a good
valuable asset.
It is indeed.
And I would like to say, and you touched on this with Dr. Marcelino, I still call him Tommy, but from day one, he was receptive and helped facilitate everything through the county, through the state. and then locally with Watkins, with Lawrence Memorial, and all the people on the ground there. So he's done a good job with that as
He
well.
really has, and we'll continue to be leading our
Yep.
contact tracing efforts as we go into the semester through the county department. And so,
Well, since I butchered his last name, I'm going to call him Tommy from now
Tommy.
on. Too. That
Yeah,
I can
hey,
say that.
Tommy.
But just a minute, just say also Jennifer Schrimser,
Yes.
over
So
at
she's-
Lawrence West, an infectious disease doc, who I think
Yeah.
you know really well.
Yep.
She's great. I mean, that combination, that's really helped things out. So.
Yeah, you know, she trained here, and this has become really a second full-time job for her, and she's doing everything, but also doing her patient care duties
So
as
it's-
well. So
it's
well, and I think that's worth pointing out of everybody involved with this.
Yeah.
Everybody has day jobs.
Yep.
Just as your hospital has a day job, which is taking care of this community, and then COVID shows up, and now you have 2 day jobs.
Yeah.
Yeah,
And,
absolutely.
but that's true at our university as well. Everybody had day jobs, and now we're trying to figure out this on top of that, and they've really stepped up and to help us get to this point. And Russ Johnson over at Lawrence Memorial has
He's
been a
been
great
great.
partner
Yeah,
as well.
he's been great.
And he's going to, I think, be invaluable for us as we figure out the collection side of things.
Yeah, no, I think we're going to lean heavily on LMH to help us out with that. And just say you got a strong team too. Barbara Bickelmeyer is your new provost. She's been a delight to work with from our standpoint, and Jennifer and Tamara. So congratulations.
Yeah, it's a
Yeah,
good
got
team.
It is a really good team. Well, let's turn first to media and see if there's questions out there that they might have. I'm not hearing any, so let's go directly to our listening audience, because we know we didn't get to many audience questions yesterday. I bet they're building up today.
Well, and we have a lot of questions for you already this morning.
So really, can Dana and I take the day off? Are we done now?
Yeah,
this
this is
works?
pretty much going to be
back to
the
your
Yeah, back to my day
the
job.
chancellor update from about this point on, probably. So Debbie Ann wants to know, when are you going to update on which classes are online and which are in person?
Yeah, that's a great question. We're going through that process right now with our deans, with our chairs, and with the faculty to figure out what the right combination is. I believe we will have that in the next week to 2 weeks, that we will be putting out the new format for people to look at and modify.
Jean is wanting to know, what is KU going to do about fraternities, sororities, dorms, and private apartments? And how are you working with the community? I mean, if you have somebody living off campus, they may not abide by the same rules in the sorority, right?
So the Greek community is partnering very closely with us and with our housing team, who has throughout the summer been working on how to reorganize our dorm life, if you will, in a way that we believe we can really create a safe environment for our students. And the Greek community has reached out, and they are kind of lockstep with us in thinking through that. And of course, they have all the same concerns. And they're all parents and alumni who run those things, and want to make sure their students have a good experience, but in a safe fashion, and can successfully complete the year. So I really appreciate their partnership, and I know that we will continue to develop all our program. And again, they'll be part of the testing program, and they will help us on the collection
I
side of
think
that.
it's been great.
And then they work closely with our student life folks on campus as well in terms of personal responsibility and codes of conduct, and so we really view them as integral parts of our housing, even though they're not our housing. They're our housing because they're our students.
Hey, Chancellor, one question that has come up, when I mentioned that story the other day, one of my patients in clinic saying, how do we reopen? But when you've looked at this question of even reopening altogether, you thought, man, if we don't reopen, we may be damaging some people and some people's careers and what's going on. Talk a little bit about the flip side
Well,
of thinking, gosh, what happened to
if
them?
you look at, we learned a lot through the spring, just as you all did. We told everybody not to come back from spring break. We took a week or 10 days and flipped everything to the online format, and we got through it. It wasn't pretty entirely because we didn't have time to do it, and we're spending this summer thinking about how to do that more effectively in terms of using the technologies, and we've invested millions into technology to be able to do that more effectively. But first of all, not everybody even has a home to go to, let alone a good learning environment at home to go to. And so really, some of our populations who rely on us the most are those who are the most vulnerable for a number of different reasons. And they struggled through the spring, and they've told us that. And they also shared with us that when we talked to them about their experience in the spring, what went well, what didn't go well. And they start talking about the things that they were not able to take advantage of. They do eventually get to the classroom, but there's so many other things like their experiential learning opportunities, their student organizations, their performances if you're in the performing arts, their studio time if you're in design or architecture. I mean, there's so many elements of their education that are far beyond what you can deliver entirely online. And so both to make sure that everybody's able to not have to take a pause in their life by what's happening, to allow them to continue their education and to be able to provide a platform for those who would really struggle to do it otherwise. We just feel it's really important for us to do our best effort to get them back and provide them as much as we can of the college experience, if you will.
Well, and if we know that people are responsible and do wear masks and socially distance, even in homes and dorms, you can be safe, right? Because we know that from the Chinese data and from our own data, that if people stay separated just a little bit inside a house with one person having COVID, the chances of everybody else getting it are less than 50%. It's like closer to 10 or 15%.
Yep.
And if you can wear a mask even inside a dorm, you can stay safe. That mask thing turns out to be just so darn important.
Absolutely, yeah. And the household attack rates of somebody who has and gives it to their household is anywhere from 5 to 30, but really the average is 10 to 15%, which is a good thing.
And that's without a lot of mask wearing. So
That's
wear
without
the
mask wearing.
Yeah.
It even decreases it even more. So I think we can do those things. And just as you mentioned about the housing and the fraternities and sororities, we have Chris Wilson here with the health system, who's really been heading all this stuff, who's been in constant contact with all the people in housing, including the fraternities and sororities. So that is a big issue that we are working with daily.
Yeah, I don't know if he's out there, but Chris Wilson has just been a lot of the glue for us from the standpoint between the health system
And
the
us.
university.
Yeah.
He's just done a great job.
Great partner.
Yeah.
But it was also mentioned the rest of students that are off campus and those who are living in other environments across the community, of which actually is the majority of our students. They're members of the community like everybody else, and so a lot of our challenge, to be honest, is going to be create that mask wearing culture.
Yep.
We've been trying to do it over the summer already within Lawrence as a community. We have a mask order, obviously, and I was down on Mass Street this weekend, and people are doing a pretty darn good job of it. But that has to become our culture for this coming semester. It just has to be.
Yeah.
And we all have to get comfortable with it. And I know people say they're not comfortable, but I've done 20-hour surgeries in masks.
and you wear
can do
masks.
this. You do this.
Okay, so here's
this is doable.
This is my favorite story. That people say they don't want to wear masks. I'm like, well, wait a minute. You do understand this is a disease that spreads by how you breathe. And would you let, or even want your surgeon to do a surgery on you without a mask on, so all their germs go into your wounds? That just feels really bad. I think you would know that.
Yes.
Well, and a great analogy came out last night on after our call. Professor David Volkins on our team, on the advisory
Good.
team,
He's
and
great.
he had heard the analogy, which I thought was really fitting. He said, "Not wearing a mask in public right now is like drunk driving. You're putting yourself at risk, and you're putting everybody else at risk."
Yeah. And it's temporary. We really do think
is.
vaccines,
It is.
you look at the data coming out around the vaccines, it's encouraging. And so we just have to think, okay, I've got to buckle down and help my family, myself, and the ones I care about, and really our whole community get through this together. Because together we could do it.
And we know it works, right? I mean,
we already made it work once.
And well, it's working here in the health system. You guys never slowed down. I mean,
Right.
and you've not had transmission at work. But even when you go to the community, and I think CDC just published the article out of Springfield, Missouri, where
Yes.
the two
Yeah.
hairstylists were positive, had 140
40.
clients, I think it was.
Yep.
Zero transmission.
All because they wore a mask.
They all
and the
wore a
clients
mask.
wore a mask, and the stylists all wore a mask. So when people say, "Can I go get my hair done safely?" Yeah, you bet you can, as long as they have a mask on.
Yeah.
It makes all the
So we
difference.
know it works, and we know we can be safe, and we know we can live our lives and be safe with minor modifications. So
Yeah, and it is
that's
sort
our
of minor,
plan.
really. Yep.
That's our plan.
Jill?
Okay, Quinn, on the mask issue, she said there's not great evidence that this age group that's coming back to campus is wearing them. And she wants to know, what will the orientation and expectation be, and what do you want parents to help you do?
Well, obviously, we have that expectation. We're communicating that expectation. We are starting a social media campaign around it. We are creating graphics around it, and we will provide masks to those in our campus housing. We will, and have it available in our buildings to make sure that people have access to those. But certainly we need the community to come together and say this is the expectation in our
this is our
community. We have to
culture
hold
now.
each other
Yes,
accountable for
we
it
do.
at the end of the day and be socially responsible. There was just I was reading a survey last night that said 96% of college students that were surveyed are doing all the right things right now. And say that they will when they come back to campus, and it was in the 90% where we said they were willing to wear a mask. So, I think the majority are there. We just have to get all of them there.
And I think when it becomes a culture and everybody's doing it, you get constant reinforcement. I think it can change because we've seen it change already in other countries. We've seen it change in other parts of the United States where mask wearing has been more of the culture. So we can get there. But like I say, it's all about being on message and demonstrating that and showing
I agree.
it.
Several people have questions about testing. Teacher gets COVID, who all gets tested? Student gets positive, who all gets tested? How will you manage that?
Well, that's a big part of the contact tracing elements of that we're going to be working and relying largely on the county to help us with that. And then they interview, anytime somebody's positive, they interview them, and you guys can describe it even better than I, but they interview them, and it's really a matter of figuring out who did you have prolonged close contact to in a high-risk environment, and then they reach out to those folks to ask them to either isolate or if need be, get tested.
Yeah, I think that's key. And one of the things we wrestle with is how far back do you go? And one of the key things is to make sure your testing turnaround is rapid. So one of the things that CRL has done is talk to us about how fast we can get those test results back from the Lawrence campus.
Yeah, I mean, certainly the results are going to be back, 24 hours, 48 hours at the most, which is a lot better than a lot of places. The testing and the turnaround time is extremely important when you do the contact tracing. So the other thing is when you are doing contact tracing, discuss, who have you had contact with? Just as you said, prolonged contact at a close range. Hopefully, if we are in a lecture hall or a classroom, just as if you're in a clinic, you can maintain that 8 to 10 feet or more. If you're in a lecture hall, obviously you're going to be more. If the professors or teachers are masked as well, that will help reduce and help decrease the need for contact tracing, because the proximity of the students and other people to whoever may be infected, if it's a professor, is going to be very low. But the important thing is getting the contact tracing done and then getting the quick turnaround on the testing. And if we can do saliva testing, that's a lot easier. If it's proven to be efficacious and reliable, we can do that. We can get those results turned around quickly and go from there.
Talk a little bit to, there's an app that we may be using on the campus to help identify and make you screen yourself for symptoms.
Yeah, we've been working with a group called CV Pass, and it's a nonprofit that one of our adjunct faculty, actually Brian McClendon, founded or co-founded with 20 of his Silicon Valley tech colleagues. These are the development folks from Google and Uber, and Brian himself helped develop Google Earth. If you ever notice when you open that, it starts over Lawrence.
I didn't know that.
That is not a coincidence.
Center of the universe.
There you
But
go.
Brian really feels very strongly that we need to figure out how to coexist with this virus in the interim term, economically, educationally, and so
true.
his team has really developed this app, which is the trick is privacy and HIPAA compliance, and so your data doesn't go anywhere; it's just on your phone. But it is an app that you go through a series of questions every morning, and that gives you a code, and that code is what you scan to get into a building, and says that you're not symptomatic at that point in time.
Right.
And so it's just one more sort of check, if you will, to help us all remember to check those things on a daily basis. And if you have some symptoms of concern, then we'll have a hotline that you'll call and get advice on what you need to do, and you may need to come down and get tested, depending. So we've been the beta site for that platform. We've been using it over the course of the summer in our research buildings as we started to open up research. It's been really quite effective. Continued development of that product, and we now are setting up kiosks in many of our buildings with iPads that you will scan your code in to get into the building.
Yeah, that is so good. That's just great.
On that note, Kim wants to know, are all the offices and buildings and everything going to open at once? Are you going to stagger it?
So, we are over the next several weeks going to start repopulating the student-facing elements of our campus. But to be honest, there's a lot of folks we probably will not bring back to campus this fall. If they don't need to be there, we're asking them to continue to work from home. And if they can work effectively from home, and they are working effectively from home, then we will want them to continue to do that for the fall. But obviously, we have significant components of our campus that are student-facing and provide services directly, and some of those can be done remotely, but some will need to be face-to-face. So we will be slowly opening that up really over August in anticipation of the return of the students.
Donna has a thoughtful question. She says a lot of students go home on the weekend. How are you going to manage that or advise them?
to behave at home as they do on campus, which is wear your mask, socially distance, and wash your hands.
And you can't stop them going. They're going to
Right.
free travel
And-
because they're not going home. They could go to the grocery store. I mean, it's
Right.
all,
No, it's
we're all
just, and for the parents, I would say the same thing. I mean, we are much more casual with those that we cohabitate with, right?
Yes.
Because
Inside the bubble.
likely we're in the bubble, exactly. So when you are going to have to consider your student coming home not being in the bubble, probably.
Yep.
I
It's a
assume
little
that would be
difference.
your
Yeah.
advice.
I think that's right. I think when they come back to the home, they're going to have to be a little more distance in the home. People are going to have to wear a mask, sit outside
Right.
to have dinner. It's not the same as if they were constantly in your bubble.
Right.
My daughter came home from Chicago. We had to do the whole screening thing and everything after a day or two. I think maybe our bubble may have broken down. We kind of let
Yeah.
her into it, but it wasn't right away.
No, and my daughter came back from working in Reno and quarantined for 2 weeks. I
Yeah.
mean, it's just what you need to do.
You just have to act like the virus is out there, not from a standpoint of fear, but from a standpoint of knowledge, and continue to do those smart things that we've been talking about.
I think that's a big part of it. Like, I know that my daughter had quarantined or had self-isolated in her apartment before coming back. She's really good about following, so it felt a little bit easier, and she didn't fly, she drove. And so, I mean, you just have to, in your own mind, perform the mental calculus of, and then decide what your
Run the
risk tolerance
checklist.
is.
Yeah.
It is. It's all about the check.
Andrea says if masks are what makes the difference and hand gel, then will those be provided to everyone? And why don't we just do that in Kansas? Why don't we just buy everybody their own supply of masks?
Well, I
and
think
keep
for
it
the
masks?
Kansas question, we can bring Lee Norman back on and ask him that question, but I'm not sure we can answer that one.
On the campus,
But
who will
if you
have
come
their
to our
own mask?
campus, well, if you come to our campus, you're going to get a mask if you don't have one. So that, and I think if you walk into stores now, if you don't have a mask, you're going to have, they're going to provide one for you. And so I think that kind of is the culture. You can get a mask. So
Right, and we will have them available as well. And of course, if you want fancy masks, you can buy those. If you want to make a fashion statement, you can do that as well,
And
obviously.
really, it's not hard to make one. You know, my wife was showing me something online, and she's like, "Here, look, you just take the handkerchief, you kind of roll up at the end, and pull it around, you got a mask." I mean, it's not hard.
No, it's
So,
not.
do the ones you're going to provide, do they say Rock Chalk Jayhawk on it?
We'll see.
Ah, I'm not going to do the big reveal today.
Vicki has a kind of a general question. She says, do you think that everyone is just a matter of time we're all going to get COVID? Do we all
right,
have
Dana,
to get
what do you
it?
think? Are we all going to get it?
Pessimistically, I would think yes, but optimistically and more realistically, I would say I hope not. I think, again, we've only had, 1 to 3% of the population that we know of has been infected. Maybe 10% of the population if we assume for all the asymptomatic. Look at everything that has happened with just that small percentage of the population. So if that percentage of the population grows, we will all be like New York or Houston or any of those places that have been hard hit. I hope not. Hopefully before that there will be a vaccine available, and so we will be able to get 1 or 2 vaccines or a booster vaccine to really protect the rest of the population.
I think even in New York, it's estimated, I believe, that 20 to 30% of the patients have had it, and that's
Right.
their great crisis. And we know that the vast majority of the antibody tests we're being asked to do, because we now do a really good antibody test, most of those are negative, which
Yeah.
means people haven't had it.
Right.
We know that the rate of positivity on the outside used to be around 1%, 2%, that's 7, 8% on our tests.
Yep.
I think it's closer now to 10 to 15%, and so we're
bit.
seeing an increasing number of positive patients who return the test positive, but it's not anywhere near herd immunity, which has to be in that 70 to 80% range. I don't think everybody's going to have it if you practice good hygiene. If you wear the mask, you wash your hands, you do
Right.
those things. If you don't do that, and you go to the bars and you go to mass gatherings and things of that nature, well, then yeah, there will be a whole lot of people who gather it or to get it. But I think actually we won't.
And I think that's what's going to make the vaccination so important.
Maybe you could talk about two things. One is the prospects of vaccine, and I know Francis Collins has started to talk about their efforts, and we may have something by early 21, which would be a game changer for us.
And we've hit that on this program a couple of times, really, that, Francis Collins did come, we've tried to get him on the program, haven't quite made it there yet, but Jerry Moran was on the program and relayed that information, that we expect to have up to 10 million doses in October of a vaccine to start distributing to healthcare workers, and 100 million in December and 300 million in January. The media reports had lagged behind that until the last couple of weeks. And now you're seeing people say, we're going to have 100 million doses. And now I believe there are at least 3 different vaccines that are in production. So meaning that they are now producing vaccines for mass distribution ahead of all the results of the trial. So the preliminary data here looks pretty good. And just to say, the coronavirus isn't really a challenging target for vaccination. It's pretty easy for as a target, Dana.
Yeah, the spike that sticks out, the reason we call it coronavirus, because it looks like a crown, basically. The spike, for most of these vaccines, that is what we are using. It's not the whole virus, it's just the RNA that we are able to put into people so that they can almost produce their own spike protein, so you can develop antibodies to that. And also, we should note that for the regular common coronaviruses, the 4 of them that we know of that cause the common cough and cold, we know from population studies that up to 90% of Americans have antibodies or have evidence of that. But these have been around for hundreds of years within our population as well.
And they cause mild disease.
And it does cause mild disease, so it's totally different. But yeah, so hopefully again, a lot of these vaccines are directing their efforts towards the spike protein. We make antibodies to the spike protein, to little pieces or areas on that spike protein, to get the neutralizing antibodies, to get immunity, but also not with the antibodies, but with the T-cell immunity as well. So we have the antibodies as well as the cellular immunity.
David Volker on your campus has been involved in vaccine development. We need to get him on this program sometimes.
Yeah. He's with a lot of the work that they do is on vaccine development, but also, developing vaccines at an affordable price that can survive, not refrigerated, so you can take them to the corners of the world. And
we need to get him out here. We're going to go find him and see if he'll be on.
Various different researchers on campus. So really, if we're looking at a vaccine in early January and enough numbers that we can really get to the population, there's really no reason everybody should get sick. We should never reach herd immunity from an illness perspective. We should reach herd immunity from a vaccine perspective.
And we think that's the truth. And plus, it means that Allen Fieldhouse could be full in February. Just saying.
Now you're optimistic.
I am optimistic, but you know that it's how I look at the world.
But one other thing maybe we could talk about, which is sort of this perception that if you're young, you don't get sick. What are we seeing there?
That's absolutely not true. We have evidence from published reports from around the United States. We have our own experience here, in which we do have a 14-year-old in house right now. We have had younger people in their 20s on the ventilator here, so they don't get sick to the proportions that the older people get, 50, 65 plus, with the chronic health conditions.
Be careful where you draw that cutoff, because I'm a little older now.
I know.
Nice.
But we know they can get sick. They can suffer significant illness. Even if they don't suffer significant illness, we understand that even young people can have the other problems, the complications that come along with it. Obviously, for the younger kids, the pediatrics, there is a small percentage that get the multi-system inflammatory disease. So younger people are affected by this as well. And you really just never know. Again, I do believe there's some sort of genetic component in our immunity of who will get the severe disease and who won't, especially in the younger populations, but we don't know exactly what that is. And really, you're rolling the dice if you are looking to go out and get infected so that you can then say you have immunity, which we don't even know how much immunity you would have or how long it would last.
And we know that from Monday, as an example, Children's Mercy, I think, is back with us on Monday, and they've been on our program once before because we addressed some of those questions. We'll hear some of their experience. They'd had some of the people who had the Kawasaki-like syndrome. They'll be back with us on Monday. We'll be talking more and more about that. But the idea that young people don't get it, that's a nice idea. It's not true. I bet we have time for
2 quick questions.
2 more questions. All right.
Okay. One of them is, if I had COVID, am I going to need a vaccine?
The answer to that is we're going to say yes.
I'm gonna say yes.
Because we have to boost your immune system and make sure you have the right active antibodies to it. We're also not sure yet on the antibody science how often you're going to have that. And if it's been like, say, 6 or 8 months since you've had COVID, your antibody and your immunology may be beginning to wane, and so getting that vaccine will be really important. I think we're going to want to vaccinate everyone across the country.
And I think to that point too, if you've had shingles and you're over 50, we definitely also recommend
You get
the shingles
vaccinated.
vaccine. So this is not a new thing as well. So
Yeah. And we get a new influenza vaccine every year because we know that the
Yes.
thing can shift just a little bit, and
Yeah.
we study it every year. So I think this COVID vaccine is going to be around. I think it's going to be around to stay, and
Yeah.
I think it's going to be something that's just part of our lives, just like an influenza vaccine is.
And then last question, Davalina wants to know, how are you going to handle sports? Big question.
It is a big question, and we're making lots of preparations. We're doing lots of testing, and we are watching what's happening as Major League Soccer is starting back up, baseball is starting back up, and we're trying to learn lessons from those. And I would say it's very fluid right now. We're moving forward as if that's going to occur, but we don't know if we're going to be able to have the protocols in place to do that safely or not yet. And so we're keeping all options open, quite honestly.
And you've been in contact with Major League Baseball
Yeah.
and others about trying to work through some
Yep.
of these questions. We had the opportunity to talk to Dayton Moore the other evening, and it's clear that baseball's working hard at trying to get this right.
yeah, they have they have just different resources, but they have got very good protocols in place. We have taken some protocols from Major League Baseball, from the NBA, from the NFL, from the other sports entities. We are working towards certainly getting KU athletics back. Jeff Long has been great. Coach Miles has been great. Everybody, with KU athletics has been great. We are working to do that safely, to keep the players safe, to keep the coaches and other support staff safe. But we are taking a lot of details, a lot of protocols and strategies from other people so that we get the optimal and the best practices moving forward.
Yeah, and I do think it's been a lot of best practices. Thoughts about how other universities are welcoming back? What are you hearing out there, Chancellor?
I think everybody's trying to learn from each other. So there's a lot of crosstalk going on in the state of Kansas, in the Big 12, in the AAU. I mean, I think we're all leaning pretty heavily in trying to learn lessons from each other. And it's challenging because we're at a point right now, and we have been for several months, that everybody wants answers when there aren't always answers. And so it almost seems like every week we have new information that is guiding what we're doing,
Yes.
and we're evolving as that information comes out. And
Yeah.
I feel much better about where we are right now than 3 weeks ago, quite honestly, in terms of and with every passing week, I feel better about what we've been able to get in place. The saliva testing becoming available, which we can do on mass scale, which was key. I think key for us to be able to safely get our campus open, and I know that's going to continue to evolve over the
Yeah.
summer and the fall, quite honestly. So we'll be doing things different, I think, in September than we're doing right now.
Yeah, we learn. We say we'll be smarter in 2 weeks. We'll be
Yeah.
smarter in 2 weeks. And so far, we've always been smarter in 2 weeks, but we've never known enough.
But the velocity of what we're learning is increasing so much that it's not 2 weeks, it's just a week.
Yeah.
So what we're saying today, we'll probably still be somewhat consistent, but some of our best practices may change, or what we think may change.
But
because
what
of
hasn't
things.
changed is the base principles of infection
The
control.
pillars of
We talk
infection
about them every
prevention,
day.
yep.
Hey, tomorrow we have a really special guest on. We've been so lucky with some of the good folks we've had on. Sonia Bartolome is a pulmonary and critical care medicine physician who is a med student and did a residency in pulmonary training here at the University of
Yeah.
Kansas.
Remember, Sonia?
She is now the Chief Quality Officer down at the UT Southwestern Medical Center, University of Texas Southwest in Dallas, and good friend of all of ours. And so she has agreed to come on the program and talk a little bit about what's going on in Dallas, Texas. They're ahead of us in terms of all the things that have gone wrong, but they've also got to learn a lot of lessons about what has gone right. And she's in charge of the COVID response at UT Southwestern. I think there are a lot of lessons to be learned, and we'll have a great conversation with her. And tomorrow, really a lot of questions from our listening audience, but we'll be kind of hearing both about what's happened in Texas, what are they doing, where they're closing bars back down and restaurants back down, and mask wearing has kind of come back on again, and having a good conversation about what to learn from there. As we end the show, though, today, final thoughts, Chancellor.
Well, final thoughts is we're excited about what the fall's going to be and what it's going to look like. We know it's going to be a challenge. It's going to be a very different fall than any of us have experienced, but it's a very different summer than any of us have experienced. And most importantly, we know how to do this. We just have to do it right.
Yes. You know, I'm a Tiger, but I got to tell you, Rock Chalk, you're doing great. Keep it up.
We'll forgive you that.
I've been at KU for 30-plus years, you know. I've got more crimson blue in my house. I hate to say this. Oh, my
That's right.
God, I can't even say it out loud, than black and gold.
Yeah, as we stated before, you know, you have to act like the virus is out there. Again, not from a standpoint of fear, but from a standpoint of knowledge. We are trying to give you the best practices, the most up-to-date medical information. Continue to practice the public health guidance in the pillars of public health: physical distancing, mask wearing, not going out if you're sick, proper hand hygiene. All of those things are going to keep you safe as much as possible, reduce the risk as much as possible, and keep your family safe.
A couple of photos today. Debbie from Iola, Kansas is a smart shopper and has made a bold choice of her mask with a leopard print. Gold stars all around for showing your dedication. Julie brought this picture in of a very young man, assuming it's a relative. He doesn't seem to mind that mask. And, you know, if kids can do it like that, by gosh, we all can. Anna has written, my son got married, and we kept our distance from others and used great hand hygiene, and they had a mask on. Kids are troopers, never complain. And finally, Riley shows us how she wore a mask while registering to vote. You go, Riley. Well done, and good job registering to vote. Hey, one more picture to show, but before we get there, I want to say one more thing to you. You know, every day we end this program and we talk about how there's no place like home. And that's true. But home can be at a lot of places, and sometimes home is a college campus. It may be your dorm room, maybe your fraternity house, your sorority house, but the same ideas are still out there. Because you know what? You got to keep each other safe. That's your home. That's your bubble. So make sure as you go out into the world, those base principles of infection control, they travel to whatever home you're at, to whatever place you're at. It keeps you safe. It keeps the people you care about safe. And it's not so bad. It's the mask wearing. It's here for a while. It's not a permanent thing. We'll get through this, but we're going to do it together. And we're going to do it right there with Marvel Man. Dana, who is this Marvel Man right here?
Yeah, Logan, you weren't supposed to put that up there with the Green Bay Packers mask. It should have been
A Chiefs.
Chiefs
Yeah.
Bears mask. Jayhawk. So this is my brother-in-law. He's going for surgery today, just to show that there are people who need surgeries, and they're not emergent, but they're very important for them. He had testing prior to surgery, and he was negative, and he's going to the facility now, and where they're taking all the same precautions, keeping patients safe, keeping each other safe, keeping healthcare workers safe. All the same precautions we're doing here to keep you, the patient, safe and your loved ones safe. There's no safer place than the hospital.
Agree.
When you need surgery, and it is important for you. It's not a minor surgery, it's a very major surgery, no matter what that is. And we're still here prepared to make you feel well, make you do better, make your quality of life improve. We're doing all those same things. Keep wearing the mask, keep physically distancing.
This is probably the safest place you can be
Absolutely.
It
right
really
now.
is.
So,
It is.
so
We
if
work
you
so
need
hard at
care,
it. Come
Because
on
everybody's
down.
doing
seek
everything.
care.
Yep.
Yes, absolutely.
Chancellor, thank you. Hawkeye.
Thank you for having me.
You betcha.
All
We're
right.
back tomorrow. And
Yes.
remember, no matter where you are, and wherever that home may be, there's still no place like home. Rock Chalk. We'll be
Rock
back
Chalk.
tomorrow.